Oh no, was that muted?
Yes.
Oh no.
All right, a couple more people came in, so we'll start again here.
Oh yeah.
Started your flow. I apologize.
Okay. Oh, it's all good. Okay. So I think we had a little technical issue with the with the volume. So I apologize to anybody. Puts us about 2 minutes behind, but I'll try to make it up. So anyway, thank you guys for being here. We really appreciate it. Anybody tuning in live, anybody watching this later. My name's Dr. Trevor Wilkes. I'm one of the shoulder and elbow specialists with OrthoCincy. Tonight, we're going to be talking about Tommy John injuries, Tommy John surgery. I think it's a good topic. It's kind of relevant. Summer baseball's here. The Reds, summer baseball travel teams are kind of hot and heavy. So I think it's a good topic. I just want to mention OrthoCincy and myself, we're in a really nice partnership with the Christ Hospital Network. We partner with them for sports care here in the Forest Hill School District. We also partner with them for surgeries at the Christ Hospital's really lovely Joint and Spine Center and the Red Bank Surgery Center. Just by way of housekeeping, you guys are all muted, so you don't have to worry about your background noise. Any questions, concerns, technical issues, we have a wonderful administrator here helping me out. Please put in questions. I love this to be interactive. I'll do my best at the end, and we'll try to answer all these. And then this is being recorded. If anybody wants to see this later. I have no financial disclosures. I'm not presently invested in any companies being mentioned here. And this is purely an educational talk. Just a little bit about myself. I am a board certified orthopedic surgeon. I've been in practice actually 14 years now. I have fellowship training in both sports medicine and shoulder surgery. Personally, my practice is about 70–75% shoulders and elbows. I have 3 wonderful children. My wife's a pediatrician. We're kind of an outdoor family into dogs. I'm from Lexington, hence the UK slide right there. So a little bit of background. It's kind of a fun story, and we'll kind of kick off the talk talking about the original Tommy John, the namesake of this injury and this surgery. So this is he, Tommy John. He was a kind of a journeyman pitcher, 26 seasons in Major League Baseball. In 1974, in his 12th season, he blew out his medial elbow. He went to a really famous orthopedic surgery in Los Angeles called Dr. Frank Jobe, who kind of innovated and developed this first surgery that we'll talk about. That was done in 1974. So amazing to think, 40 years ago now. He did really well after that surgery. He went on to pitch 14 more seasons, although a lot of people like to point out that he was really a ground ball control pitcher and really didn't throw with a lot of velocity, and that really could have helped him a lot with his longevity, something we'll talk about later. From an anatomy perspective, the UCL, or the Tommy John ligament, is on the inside of your elbow, so the part up against your body. It is a ligament, so ligaments are what go from bones to stabilize our joints. The UCL has 2 bundles, so the anterior bundle, the posterior bundle. When we're pitching baseball, the anterior bundle is far and away the most important, and you'll see how that comes into play in our surgery later. The really famous statistic that you guys want to remember that gets thrown around a lot is that when we test the UCL in a lab, so in a biomechanics setting, the UCL can only withstand roughly 32 to 36 Newton meters of force. Yet when we do biomechanical analysis on pitchers, so high-end collegiate, minors, major league pitchers are easily putting 70 to 90 Newton meters of elbow torque on their inner elbow. And so it almost seems like a paradox, and that's something a word we're gonna use a lot throughout this presentation. Like, we're not even sure how these pitchers' UCLs last as long as they do. We know that the bones and the muscles around the elbow can help absorb that force, but we're in this kind of constant fight to try to preserve the UCL because the mechanics of pitching seem almost double the failure strength of a UCL. We're going to talk a little bit about pitching, biomechanics, and energy. And it's just a quick reminder, a really crude representation of the basic biomechanics of pitching phases. beginning with wind up, stride, arm cocking. And we want to think about this whole process as the process of storing up energy, kinetic energy, delivering it to the ball, and then releasing that ball with control. And the concept here are how we can build up energy with the strong muscles of our body, our legs and our trunk, how we can store that energy up through the cocking phase, and then how we can deliver it. And you can see there that it is really at cocking and acceleration and ball release that we're putting the most pressure on the elbow. So now kind of moving into the meat of the talk here about the problem that we have with young pitching athletes. I want to start all this off with a basic kind of paradox or double-edged sword. The theme you're going to see throughout this presentation is the same things that are going to make this young man in the picture in the picture a really productive, effective pitcher, i.e. practice, volume, and being able to throw harder, velocity, are the same things that are going to put him at risk of hurting his UCL. Do we have a problem? Well, the data would suggest we do. So presently speaking, 15 to 19-year-olds in the United States are the fastest growing portion of Tommy John injuries. 57% of all UCL surgeries on this age group. Studies have shown that if we follow 9 to 14-year-old pitchers over a summer baseball season, so what a lot of you guys might be involved in right now, that half of these boys complained of shoulder and elbow pain. Just throwing curveballs and sliders, as you can see there, statistically really increased the boys' risk of complaining of shoulder and elbow pain. And the number 1 and 2 factors of whether these boys would complain of shoulder and elbow pain was the number of pitches that they threw in a game and in a season. And we'll go through some of that data later. Presently speaking in the United States, and I think we have this in here later, we have almost a 7% annual increase in young kids getting UCL surgery. So it seems to be going up rather than flatlining or going down. So this next slide is taken from the Major League Baseball's HIT database. This is a really good cumulative database that's been going on since 1974, the first year for Tommy John surgery. And they've been collecting this data. So since that time until 2013, there were 179 UCL surgeries in Major League Baseball. In those studies, they found that roughly 83% of those pitchers returned back to baseball. 90% if they were going to the minors, so a little bit better for lower level pitching. But in a 2010 study, which looked at all ages, so kids 14 to college, a good study that looked at 1,261 kids, only 83% returned to competitive pitching. And that's actually a statistic I use a lot with patients in my office who are coming in starting to complain of medial elbow pain, because I think there's an idea out there that this surgery is really perfect, and it really isn't. It's a great surgery and a wonderful surgery when used appropriately. But even if we take that there's a 10 to 20% risk that our boys won't go back to pitching, I think we can all agree that's a pretty statistically significant risk. And so I think this slide really puts the value on injury prevention as a really important goal. I wanted to touch briefly on just the concept of how this surgery works, and then we can talk about how to prevent it. Traditional ulnar collateral ligament surgery was the surgery used for pitchers who had worn out their UCL. So these are the pitchers who've pitched a long time. There's attritional wear on the tissues of poor quality, that they've had kind of a long, slow, steady process of developing problems. And in that traditional surgery that you see here in the image, we actually use a graft. Most typically, we take that graft from your wrist, but it can be taken from other places. But suffice it to say that we drill tunnels in the bone. We try to mimic the normal anatomy of the ulnar collateral ligament. And a combination of this graft and our stitching creates a new ulnar collateral ligament for the athlete. Now, recently, there's been a lot of interest in UCL repair. So repair would be trying to use the athlete's native tissue to fix it. We also have some really neat new surgical techniques called internal bracing as a way to help that heal better. It's important to know that candidates for repair surgery, though, is a really narrow niche. These have to be kids typically with an acute injury. So it's the pitcher who had very little medial elbow pain and then through one pitch felt a pop, really knew they'd hurt themselves. Typically, these injuries, the tissue will avulse or tear off the bone. And then we can use these sutures, the internal brace technique, and we can repair it, rehab them. One of the neat things that's been very exciting is the outcomes have been very good. So if we're able to catch these quickly, fix them well, the return to pitching scores have been really high, 92%. And their outcome scores, the K-JOC, that's the Kerlan-Jobe outcome score, has been essentially nearly normal, almost like an uninjured elbow. So some good surgical results with repairs. So let's get in now into like injury prevention and what we can do. What are the modifiable factors that we could apply to our kids to try to make a difference? So do pitch counts make a difference? Well, the data is really quite clear that they do. We have a ton of data from little leaguers all the way up through high school, college, and MLB that makes a big difference. This is kind of a classic study that gets thrown around a lot from 2017. Looked at 638 pitchers who threw in the Little League World Series. Of those pitchers, 10% went on to become professionals. Only 1% threw in the majors. It's always a nice little stat when you're watching Little League World Series. They're amazing. They're really good pitchers. Only 1% of them are going to throw in MLB. But in this study, they followed all these kids, and 23%, or almost 1 in 4 of those who became professional, underwent UCL reconstruction. So then they went back and they looked at those kids and they looked at whether they had been following pitch count rules. Kids who reported following pitch count rules only had a 2% risk of having UCL surgery. Kids who did not follow those rules had a 50% risk. So a really big difference. Now, even though that statistical difference was really big, when they looked at their pitch counts, it really only came out to be around 10 extra pitches per game, but translated over a whole season, that was 500 extra pitches per year. And that's a great example of the ways in which this volume really adds up on these young pitching athletes. This next slide shows the USA Baseball Pitch Smart guidelines, which I think really are taken as the guidelines now for our pitchers. It's what we use with the teams that we work with. It's what we use when we're rehabbing our pitchers. And it's what we use when we've performed surgery or treated somebody without surgery and we're getting them back. So most baseball coaches, pitching coaches are pretty well aware of this, but important data for everybody to have. So where do these pitch counts, I want to introduce the concept of workload, right? So pitch counts are one thing, but pitch counts in a game aren't the only way that athletes are accumulating volume and stress on their collateral ligament. So in major league pitchers, only about 57% of their throwing actually happens in a live game. 23% are in bullpens, 20% are in warm-ups. And in one 2016 study of Major League Baseball pitchers, 40% of their medial elbow injuries occurred in out-of-game pitching, bullpens or warm-ups. So that's another thing I think coaches need to keep in mind, is that all of this extra throwing is not without risk. It needs to be considered part of this overarching theme of workload on the elbow. What are the risk factors for UCL injury, and can we predict who is going to have these problems? Well, obviously we can't predict with 100% accuracy, and there's always going to be outliers. But when we've done statistical analysis, there are a number of things that seem to line up with a lot of significance. So we already talked about pitch counts. They need to be age appropriate, following the USA Baseball Pitch Smart guidelines. We see 100 innings per year as kind of an inflection point where the risk factors start to go up. There's this really interesting concept of pitching under fatigue. So consecutive days of throwing, perhaps a lot of heat, multiple teams. I was talking to some friends recently about the pitch clocks, and I think these are such a new factor that it remains to be seen what influence they'll have. But if by speeding up the time we increase fatigue, it's possible that they could also be a risk. Velocity. So again, this brings us back to that paradox. Of course, velocity is going to be an important part of being a more effective pitcher, but it's just going to straight up make you at higher risk of a UCL injury. So we know that the absolute volume that people throw, the absolute velocity that people throw is a risk factor, and we're going to go through some data for that. BMI, or your body mass, so bigger pitchers at younger ages were at higher risk. We think that's just a proxy for their ability to throw harder, generate more torque on the elbow. And a really interesting study that my friends and I talk about a fair bit is warm weather climate. Some studies of collegiate pitchers coming out of warm weather climates where they've been throwing year round showed they had a very significantly increased risk of hurting their elbow. That number P less than 0.000 means that the statistical likelihood that it was due to chance is incredibly unlikely. So that again speaks to that idea of volume, workload, and a lack of rest. Can we examine somebody in the office and see if they're at risk? And the answer is yes, we can. So we actually have some really neat research. I spent a few years as a team doctor for the Lexington Legends, which is a single-A minor league baseball team in Lexington. And we actually did a fair bit of this research with the Legends while I was there. We were part of both the Astros and the Royals organizations. But if we take an athlete and we measure their throwing arm against their non-throwing arm, if they have over a 5-degree difference in the range of movement between the two shoulders, they have over a 2.5 times risk of hurting their elbow. If when they stretch across their body, like that picture to the left, if they have over a 15-degree difference, they have over a 5 times risk. Now, what these things are is demonstrating tightness in the back of the shoulder, so the ligaments in the back of the shoulder. And what we believe is that tightness doesn't allow the shoulder to go through its normal arc of movement, and the dissipation of forces comes down to the elbow. And that is why we're seeing these increased elbow injuries. Another thing that we can test is that weakness of the rotator cuff. So this has been done in preseason training with professional baseball players. And if they have significant differences side to side in their rotator cuff, then we've seen statistical increases in their UCL injuries. These give us some objective targets that we can work with athletic trainers, therapists, and screening for injury prevention. Now, I mentioned earlier that velocity is associated with UCL tears. And that's absolutely true. So we have seen in study after study that the #1 independent risk factor for whether or not a pitcher would have UCL surgery was velocity. So that's been shown in studies of Major League Baseball pitchers, minor league baseball pitchers, and to almost all different levels. Now, one thing that I think is interesting, if you look at that data there, you'll see that the differences weren't huge, though. You're really just looking at 1 to 2 mile an hour differences. And so, again, it gets back to this really difficult paradox of performance that we are pushing our pitchers to find an edge and to throw, 1, 2, 3 miles per hour harder, but at the same time, we're putting their elbow at risk. Just 2 years ago, there was a consensus meeting of the Major League team docs. They all got together and essentially had a meeting in which they used something called the Delphi process to try agree upon some principles of UCL care and management that everybody agreed upon. So some things that I think we can kind of take as, well, there's no such thing as absolute truth in science. We're always testing and hypothesizing, but as our present gospel and the things we believe strongest in presently. And here's what they said. The risks for UCL tear were primarily overuse or volume, increased velocity, weakness in the kinetic chain of a pitcher, meaning weakness in their trunk, their hips, their core, poor mechanics, and we'll talk about that a little bit later. That primarily has to do with hip-shoulder separation and lateral release point of a ball, and then the objective range of movement deficits that we talked about just a couple slides ago. All of these doctors, trainers, and therapists agreed that conservative care was a good first-line choice, except in the settings of acute traumatic injuries. That conservative care should comprise avoiding stress on the UCL, so modifying your throwing, strengthening of the kinetic chain. The more energy we can deliver to the shoulder, the more we can protect the elbow, and then making sure that our athletes had none of these deficits in range of movement to their shoulder, range of movement to their hip, that we had worked with pitching coaches, that we'd optimized their mechanics. I put this in here, PRP gets kind of a lot of press. I think all of these team doctors agreed at presently, there's maybe some promising research from animals, but there's really a lack of evidence on humans, and there's no good control group studies. And that surgery is really reserved for the failure of good conservative treatment or acute high-grade tears. There's a little bit of a question of whether one type of tears, where the ligament tears off of the ulna, sometimes do worse with conservative treatment, but that is something I think we're looking into with further studies. We talked about fatigue here, so I want to talk about mechanics for just a second. The hip-shoulder angle, so most pitching coaches, throwers know this is an important part of generating kinetic energy, velocity, storing up energy you can deliver to the ball. But what happens with this technique is, as the athlete begins to fatigue, he loses the coordination or the linkage between his legs, his trunk, and his shoulder, and that elbow begins to lag behind. And you can see in this picture how far behind the trunk and the shoulder this athlete's elbow is. As the elbow lags behind, it becomes the victim of the whip or that catch. And it's that kind of traumatic torque that we think in biomechanical models is really stressful and harmful for the elbow. Also, as the athlete gets fatigues, he may be dropping his slot or release point, letting the arm come more and more, the hand come more and more out away from the body. And there's actually really fascinating research that for every 5 degrees that you continue to bring your ball release point out away from your elbow, you increase the stress on your ulnar collateral ligament. These are some really interesting points because, again, these have to be balanced against performance, pitching velocity, a spin rate. So bringing the hand out away from the body can help you improve spin rate, but you could also be putting more stress on the UCL. And so again, we're back to this theme of balance and balancing performance against injury risk. I was just recently at a shoulder and elbow meeting, and there was a lot of talk about the new Japanese over-the-top techniques in which they're trying to keep the elbow and the ball more in line with the body, not letting it get out so laterally as a way of trying to protect the elbow. So perhaps the newest Japanese pitchers we'll see will be showing more and more of this technique. So finally, as we wrap this up, what's the future of UCL injury risk reduction? I never like to use the word prevention because we're never going to prevent all of these. But I do think there are some ways with responsible coaching and load management that we could reduce risk. So some of the really exciting things that are coming down the horizon are better ways to quantify workload. So pitch counts have been our workhorse up to date, but maybe we need to move past that. Maybe we need to be looking at pitch types, pitches that are done late in game, weighting pitch counts by speed, and adjusting these factors to assess the overall workload on the UCL. There's a lot of talk in our meetings about improved recovery. So building models where athletes are able to know their personalized measurements of range of movement, of rotator cuff strength, and test these things. How do you know if you're ready to go out for your next outing? You might need to make sure that your personalized range of movement and cuff measurements are back to baseline and they're safe and that you're ready to go back out. There's some interesting research on blood markers of recovery. So looking at inflammation and muscle enzymes, letting these get back down to baseline before we put a pitcher back out on the mound. And then, of course, AI, it's everywhere, right? In everybody's news feed. And the biomechanical analyses that we've been doing for 20 years, we can now couple these with these large language models and databases, and we can analyze more of these data points, hip-shoulder separation being a good one, release point being a good one. We can put in measurements like the athlete's body mass, and we can start to predict the stresses on the elbow, and we can maybe work with these factors to try to reduce injury risk. This picture is of an app that some people are trying to develop to put onto a phone. So I think you'll see more and more of these things coming down the pike. So I think that, in summary, this is really a fascinating topic. There's not an answer to this. I think we're always in baseball going to be stuck in this double-edged sword of performance and injury risk on the UCL. And I think we're all just trying to find the right balance with our athletes and equipping our athletes and coaches with the best tools to help them make the choices that are right from them. There's always going to be athletes chasing higher performance. That's natural. But I think the more and more that we can educate and equip them with these tools, they can make their own choices about trying to reduce their injury risk. So with that, I really appreciate your guys' time and attention. And this is a little bit of data on how you can schedule. Myself, I work in the Anderson, Eastgate, Kenwood areas. OrthoCincy's got a great website for scheduling. I think we'd like to open it up to any questions now. Yeah? Thanks, Dan. All right. I actually like this part the best. I think the questions are my favorite part. But okay, so we have one. How can parents and coaches tell the difference between normal soreness and something more severe? So that's a really hard question. I mean, I think experience can really help. Parents and coaches who've been around the game more have a little bit more time. I think that normal soreness should be the kind of thing that's getting better day to day after, like, for example, a pitching outing. Normal soreness should not involve range of movement loss. And normal soreness shouldn't be the kind of thing that typically affects the kids with just their daily life, getting dressed, doing chores around the house. But it's a hard thing. And I would say that is, we're really proud to offer walk-in clinics. We're really proud to offer a lot of same-day appointments and online scheduling and working with your trainer. That's another really good tip. A lot of our schools have amazing trainers that can help with that. Next, can you elaborate on how important rest is and what is considered rest? Yeah, so number one, I would say rest is incredibly important. One of my favorite stories is, I think people forget that some of the greatest pitchers, in Major League Baseball take a full, 2 months off every year, sometimes 3, and don't throw at all. That year-round throwing is really, hence that data we talked about warm weather risk. So I want one part is just complete cessation of throwing for a period of time to rest the elbow. Another component is, rest between pitching outings. Now that gets hard sometimes with, summer baseball or even high school baseball, where a kid might be playing a lot of different positions. In general, the standard position throwing is not nearly as stressful as the pitching off the mound. The one exception to that would be catchers. The absolute volume of throwing they do from the catching position is really too much and is not rest. And then finally, if you're sore or injured, then it really needs to be complete rest. Sometimes we'll allow kids to designated hit, play first, but they need complete rest. So I guess my answer is one component is a period of time every year where you're not throwing. Another component is time between pitching outings. And then the last component depends on how badly you're sore or injured as to how much time you need. How early should kids start thinking about pitch counts? I mean, the answer is 7 or 8. There's a reason that USA's Pitch Smart program starts at that age, and that's because we think it's that important even that young. Definitely little leaguers need to be abiding by their pitch counts. There's a good one. Yeah, of course, baseball is associated with Tommy John surgery. What other sports have high incidence rates? Yeah, great question. Well, we got the Olympics coming up. Actually, throwing the javelin is highly associated with Tommy John injuries. If you think about the mechanics, you've got this heavy javelin. The biomechanics are really similar. So that's an interesting one some people may not know about, but javelin throwing, you do see it occasionally with football quarterbacks. It's a little bit different because the volume and velocity are lower. We recently had that really interesting case with Brock Purdy, where he got hit, mid-throwing motion and stopped him dead in his tracks, and he had an acute UCL tear and had a repair surgery very successfully. But basically any overhead throwing sport has that potential, but few sports approach the volume and velocity of baseball pitching. Regarding rest, what should be the recovery time between games for pitchers versus position players? Well, I mean, that's a complicated question because of what we kind of got to at the end there with regarding to, what's sufficient. I mean, I think most of us think that, at least a 3-day cycle is a really good, healthy cycle, or pitching every 4th day. That's not viable for a lot of summer baseball, high school baseball in the playoffs. I think that when we're in those situations, you got to follow the pitch counts, and you really should be working with your athletic trainer and making sure that your range of movement, your rotator cuff are all in the safe zone, and that you're safe and appropriately recovered for your next outing. What are some techniques and/or exercises that can be done to help prevent serious elbow injuries? So I love this question. I mean, the short answer to this is, if you remember how that biomechanical analysis of pitching works, the way that we use our legs and our trunk and our core to deliver body to the ball, the stronger and more coordinated we can be with our trunk, our core, our scapula, or our shoulder blade, the more we can protect the elbow. We have a saying that the elbow is typically the victim, not the culprit. It's the victim. It's the downstream place that gets whipped and torqued and hurt. But the problem is typically happening upstream in the kinetic chain. We've got these kids with, really uncoordinated hips, terrible strides, and they're just trying to whip the ball in, and they're just torquing their elbow. We've got these kids with really poor posture, droopy, pronated shoulder blades, and they're not doing a good job of controlling the humerus as it comes through. So the things that an athlete can do is strengthening their trunk, their core, their shoulder blade, their external rotators in recovery. And it really can be worth a visit with a therapist, just 1 or 2 sessions to learn that stuff. They can teach it to you really well. If surgery is required, what's the likelihood of a full recovery? We went over that a little bit. If you're a Major League Baseball pitcher, it's about 83%, minor league 90%, but in an all-comer study, it's about 85%. So it's not true that everybody makes a full recovery. There could be up to a 15% chance they don't return to pitching. Let's see, are multi-sport athletes less prone? I think the short answer, I think, is yes, because I think implicit in that question is that a kid is playing different sports in different seasons. And then by definition, they're not throwing year round. And by definition, they're giving their UCL time. In addition, by being a multi-sport athlete, they're training their trunk and their core in different ways that are strengthening it. So I think the answer is yes. The caveat to that is we still have kids that are still throwing during the football season. They're still throwing during the basketball season, and they may be a multi-sport athlete, but they're not really resting their elbow. Internal bracing as a preventative measure. Well, internal bracing is part of the surgical procedure in which we repair the UCL. And so that is a surgical intervention that requires an incision, putting little anchors into your bone. And there is such an implicit risk in doing that I don't think anybody could advocate that as a preventative measure at this time. Are the recovery timelines for Tommy John different for youth versus high school versus college? That's a great question. And the short answer is really no. I'll make a caveat to that. Biology is biology, whether you're 15, 18, 24. Your tendon cells, your stem cells, they heal the same. And we have to respect that, whether you're a low-level high school pitcher or whether you're an amazing collegiate pitcher. I will say, though, obviously the getting back to the level of performance for these high-level pitchers does take more time. So the release to pitching may be the same, but the absolute ability to perform on the mound is typically slower the more elite your performance level is. It's harder to get back to that level. And then when is the right time to consult a physician? Yeah, I mean, that's a tough question. We kind of touched on that on the first one. I mean, I think the short answer is if you have concerns and you don't feel like you have a good plan on how you're taking care of an athlete's elbow, I think it's a good time to consult at least an athletic trainer, if not a physician. You should always feel like you have a plan. And then does OrthoCincy offer pre-screening of pitchers? I mean, yes and no. We partner with a number of schools in which we work with the athletic trainers, and those athletic trainers are really knowledgeable, trained, and know a lot of these pre-screening things like total range of movement deficit, cross-arm body deficit, cuff weakness. So they know a lot of that. Now, when we see people in the office, with like elbow soreness or shoulder soreness, of course, we pre-screen them. And a lot of times I feel like one of the benefits I can offer them is then letting them meet with one of our therapists and learn some of these injury prevention programs. So we don't have a broad across-the-board program of pre-screening all of our pitchers, but we do partner with our athletic trainers to do it, and certainly we make it part of our office visits. So I hope that helps. All right. Well, in summary, I really appreciate your time and attention, and best wishes to everybody out there and safe pitching. All right.